Wow.
Like your teeth, as they were moving, they loosened. It's a normal progression of any. My teeth loosened. I actually started getting nightmares of my two front teeth falling out because they got so loose. But that's the normal progression of orthodontics. But you need a doctor to follow up on it.
Yeah,
It's
and also to know that, okay, you're
within normal
moving,
limits.
1 minute.
you shouldn't do it on another
Exactly.
tray, but Smile Direct, they wouldn't know all this stuff.
So I have one patient right now, he's in Invisalign.
what do you need?
He has amazing before and afters. I can't wait to finish this case.
My
His
phone?
teeth are moving a little more than normal. I'm like, are you wearing your trays for a full 2 weeks? He's like, no, they get comfortable after 10 days, so I switch them out. And I'm like, please don't, because
We're live? Cool.
you need the time for the teeth to set in.
Yeah,
Or
yeah.
else they'll move too fast, and that can create. So should we
We're going to start over.
start
again.
over? Okay.
Yeah.
All right.
And also, how do you know, like, for me, I'm very clumsy with my hands and I don't, you know, that's why I don't cook or do anything. How do you know you're putting the molds the right way?
You don't. So that's another thing.
Like-
A lot of times we get Invisalign trays. About 10 or 15% of the time, I need to take another impression because I don't like the fit of the trays. So maybe some of it could have been maybe a fault on.
We're live? Cool. So let's go from the top. Hello and welcome back to the Dental Bus Show. I was behind the scenes, now I'm in front of the scenes. I'm joined with my sister, Dr. Lydia, my brother, Dr. Rodi, and Heidi. In this segment, we're going to talk about Smile Direct Club. Smile Direct Club has surfaced on the market recently, and it's a do-it-yourself solution for people who want to straighten their teeth. You know, some dentists don't like the fact that another competitor is on the market. We feel, though, that there's plenty of fish to go around for everyone, and every patient has a solution that's right for them. So there's plenty of work to go around, and I think Smile Direct Club is targeting a market of people who either don't want to go to the dentist, don't care to have their teeth be perfectly symmetrical like an orthodontist or a dentist who knows what they're doing can do for them. So instead of doing nothing, they can sit at home and do it yourself solution with Smile Direct Club. However, there are things that if you do plan on doing it yourself, you must know to avoid from having less than satisfactory results or being disappointed. What's your thoughts on Smile Direct Club and all that?
So just, you make really great points. So just for the people who don't know what Smile Direct Club is, Smile Direct Club takes the dentist out of the equation and allows the consumer to be in direct contact with a company called Smile Direct Club to do their orthodontic work. So they're not followed up by a dentist, it's them and the company.
They are followed up by AI though, or there's some sort of, and we don't, they have shops all over, so they are scanning the mass of people through CAD/CAM, and that's what's great. Technology is changing, our world is moving forward. There is, all kinds of artificial intelligence solutions that are happening right now, and yes, doctors are going to be losing some of the work, or they're going to be needing to adapt to changes. Some people will lose their jobs altogether with AI coming on the market. There's two ways to look at it. You can look at it with fear, or you can look at it with optimism and opportunity and evolution. And I think it does create opportunity for people out there. However, if you are in the market and you want to straighten your teeth, you got to know why, if you should go Smile Direct Club way or not. So that's my thoughts. Heidi, from a person who is not a dentist, what's your thoughts when it comes to like Smile Direct Club and these things? Yeah.
So I think, first of all, I think it sounds really awesome. It costs, like from what I've heard, it costs way less than going to a dentist. And so from that point, I understand. And also, I think it's also very convenient. You get a tray at home, you do it yourself, you don't have to go to an appointment. All that is great. And I know there's a lot of people who want, straight teeth, but they can't afford to go to the dentist. And I heard that Smile Direct Club has like a payment plan. It's super affordable, so that's awesome. However, having gone through Invisalign with a proper dentist, Dr. Lydia, I do feel that it's not for everybody, because the thing that you don't get with Smile Direct is just, you know, even like the mole. I was watching a video on Smile Direct, was thinking, how do I know this is correct? You know, because I'm not the best with my hands, and I'm, you know, just like thinking maybe this mole is not the best. And I remember even going to your office, like you took the mole and you looked at it. I don't know what you were looking at, but you're looking at something. You're like, no, this is not good, and you created another mole. So just that alone, like I think, is super important to get right. And
the quality control aspect.
Yeah, and I knew you, you know, you X-ray my teeth, and they don't do that. And again, going in, like you can adjust things, and I feel obviously Smile Direct Club cannot replace like a dentist, and obviously it's like it's not even like the same thing. But I guess my question would be, why should we go to a dentist and not Smile Direct Club? What would be like the main benefits?
I can answer that. Smile Direct Club improves teeth, depending on what your situation is. If you're the type of personality that wants things perfect, exact, proper inclination, proper anterior, posterior position in your jaw, then you will probably be better off going to a dentist, getting that follow-up, that care, that close attention. However, if you're just looking for improvements, you know, one thing that I think a lot of dentists miss the boat on is we get taught in school we have to achieve perfection in everything, and it becomes it becomes in us. It's like, oh, it's not perfect. Well, not everyone sees the world through our eyes. I mean, some people, if they have a gap and that gap gets a little bit less, it means the world to them, and they're happy. So I think that that's a barrier that a lot of dentists fail to realize. And people like the Smile Direct Club, people did realize that there's a huge market of people who just want improvements. They're not asking for perfection. I doubt that Smile Direct Club can achieve perfection on cases, because just the nature of how teeth move. But it can give improvements. So if you want perfection, if you want more attention, I'm the kind of guy that, you know, I go to IKEA. I'd rather pay someone to come in and put the IKEA, whatever I buy from IKEA together, than me doing it myself. So it's personality. Some people like to build their own engine. Some people like to hire someone who builds the engine. It depends on how much time you have, what your budget is, what your goals are. So all of that. That's my thoughts with regards to that.
I fully agree with you. It's about philosophy and and I think just like there's a patient for every dentist, there's patients for Invisalign, and there's patients for Smile Direct Club. And we've had a few patients come to our office who've had a round of Smile Direct Club, and then they're like, we're happy with the results, but we want it to be a little more perfect, and we're following up with Invisalign. So
and they should have just gone for
Invisalign. But you know what? It was their experience, like they were compelled to do that. And even though they can't afford Invisalign, it's crazy. There's this one girl, beautiful, and she's like, I want it to be a little more rotated. And I think if maybe she was a little more aware of what she was getting into, but it didn't ruin her teeth or anything. They just made her teeth better, but not perfect. So
and because of Smile Direct Club, it's brought the prices of all that stuff way down. So you can probably, dentists are able to now deliver similar care, better probably, because, you know, if they're focused on their cases, at a fairly close amount with regards to cost, if it's a simple case. If it's a difficult case, then I think you're better off with a
Invisalign
or an orthodontist, even a specialist. Hey, there's still a specialty called orthodontics out there, and that's people who do a lot of years of schooling, and it is so for a reason, not out of thin air. So what's the deal with Smile Direct Club? We got this picture from social media, and you can see that this lady's teeth, they were improved significantly, and I bet she's so happy. She's, you know, she looks
great to me.
She looks great. She looks great. But that's the thing. you take a dentist and the dentist will be like, oh, the buccal corridor is a little dark. This needs to be twisted. Well, you know what? That's all maybe this lady needed to make her happy.
I would tell you, no one outside of dentistry would know what a buccal corridor is.
Exactly.
I mean, I know because I work with, you know, and I Google, but honestly, like, if I were, I can tell you probably like 9 people who don't work in, like, wouldn't know what a buccal.
They wouldn't know what exactly. And it's all about how you feel. You know, if you do something and you feel great about it, because if you keep chasing an illusion, you just listen to your heart, whether it's Invisalign, Smile Direct Club, or anything in life. So that's a great result, I think. And let's talk a little about how to prepare if you want to do Smile Direct Club, how to prepare for that. And I think first you want to make sure that you are cavities free. We have one patient who is doing Smile Direct Club, and she has an infection in her mouth. Now, that wasn't caught when she started the Smile Direct Club. She has an infection, she needs a root canal, and she also has bleeding gums, and she has a lot of cavities. So Smile Direct Club is not checking for these things.
Yeah.
It's good to know that it's important to get a dental checkup. Now, if you choose not to, then that's on you. So, you know, but
not Smile Direct Club.
It's not on Smile Direct Clubs, but understand that it's important to, before you move teeth, to make sure you don't have any gum disease and you don't have any cavities, because small cavities become bigger, and that's an issue. The next thing you want to know is make sure that your gums are healthy. So no bleeding gums, no puffy gums. That's very important. And then the third thing to prepare for Smile Direct Club treatment is be clear on your expectations. So if you're expecting perfection and your teeth are like this, then good luck. These 3 things, just make sure you do that. And
do they have like time? Like, do they say we are only going to give you 12 trays or something like that? Do you know?
You know, I haven't done it myself, so I can't speak, you know, with first-hand experience. But Smile Direct Club, so what happened, the reason a company like Smile Direct Club became possible on the market is because Invisalign had a patent, and the patent ran out. Yeah. And then it became a feeding frenzy, and then all these companies started coming in on the market. And then Invisalign, I think, invested in Smile Direct Club, so because they want part of that.
I thought Invisalign created Smile Direct Club.
I don't know the exact story, but there is some interest there, I'm sure. It's out of the Bay Area.
Very smart. Invisalign, you did good.
Yeah, I would. I would rather buy my competitor than try to compete. So
yeah.
So the number of trays depends on how much movement you need to have done. That's what it depends on.
Yeah, but they send you the trays all in one box to your house. So when you would come, I'd give you 2 or 3 because I wanted to see you every couple months. They get all their trays, they wear them, and then boom.
So there's no follow-up.
And so there's no control, because I can tell you, even though I'm technically a good person, but if you give me 12 trays, I would do cheating stuff. Like I would put, like, instead of every 14 days, I'll do it like 11, because I don't know. And now you tell me, actually, you shouldn't do that. But again, you know, and I think this is natural. You're like, oh, 14 days, 1 tray, maybe I'll cheat and do 12.
12 or 10.
So it's probably good that you never give me all the trays at once. I would not be misbehaved.
We need to monitor your treatment. But yeah, there's the difference between that and Smile Direct
That's good
Club.
to know. Yeah. so there you go. I hope that helps. But let's do this for people who, because part of our mission in the Dental Bus Show is to provide bullets of information in 1 minute or less. So, Dr. Lydia, are you up to the challenge of
I'm always
doing
up
this?
to the challenge. So I don't know what I'm going to do, but let me know.
Because these videos will be cut up later into like shorter videos. So if someone is searching online, hey, what's up with Smile Direct Club, or they're considering it, or they're considering orthodontics, we want to give them some information to actually help them make the right decision.
Okay.
So that's our question, how to prepare for Smile Direct Club. I got my 1 minute marker here. All right, we're gonna also see it on the screen. Are you ready?
I'm ready.
Set and go.
Okay, so if you're interested in orthodontic treatment and specifically Smile Direct Club, it's really important for you to see your traditional dentist to make sure that you're free of cavities, because those cavities can cause infection, and it can actually spread from tooth to tooth in your own mouth. And if you have a partner that you're kissing, you're also giving your partner cavities. So that's just a different topic, but that we'll talk about later. Make sure your gums are healthy, and that's part of visiting your dentist. And be clear on your expectations with regards to the result that you're going to get. Smile Direct Club may not give you perfect result, but you should be getting an improvement in your smile. So
you nailed it.
Yeah.
I mean, that's less than a minute.
Yeah,
we still have
that's
18 seconds to
awesome.
go.
And I started rambling about the contagiousness of cavities and kissing. So yeah.
All right, that's awesome.
You can give cavities to your kid. You can give cavities to your partner. You can give cavities to someone that you're in close
I
proximity
didn't know
with.
that. I thought cavities is something you did to yourself.
Buzz.
You don't give cavities, you give the bacteria in your mouth that will cause.
Yeah, but
Yeah.
like it's like I gave you the flu. I caught the flu from
Yeah.
you. That's what I
Oh.
mean.
Yeah.
We can correct that. So you give the can I correct that?
You want to correct? Yeah, let's go back. Correct.
I think you can just comment later.
I can comment later.
All right, you can
Yeah.
But basically, cavities are contagious.
Okay.
Right? Cavities
They
are contagious. So make sure.
The
Cool.
bacteria that causes the cavities are contagious. So if you're sharing a spoon with someone, you're giving them the bacteria that causes the cavities.
Perfect.
Done.
So I think that's
That was a lot of fun.
that was fun. All right.
More.
So let's go to the Heidi. Do you
Do you
need
your
to?
call right now?
I can.
Yeah, you
is
can
that
give-
any
yeah.
more?
So
Okay.
Yeah.
let's go to a
Wisdom too.
yeah. Let me just prepare something here. Let's prepare the wisdom. Okay. All right. So this next one is cool, and you have some firsthand experience right now. You're actually going through something like that.
Yeah.
Okay. So let's start from the beginning. Hello and welcome to this segment. We are going to tackle wisdom teeth. So our question for this segment is, let me make this on present mode, is should you remove wisdom teeth as a prevention if nothing is wrong with them? And we have our LA's wisdom tooth guru.
Wisdom teeth whisperer.
Am I doing the 1 minute thing, or we're just talking?
Yeah, we'll do the 1 minute. I think because when people are, looking for this stuff online, we'd like to give them that information 1 minute or less.
Okay.
But we can just go through the concept behind it. So, in your opinion, let's just go through it first, and then we'll do the 1 minute challenge.
Okay.
Sounds good?
Sure.
All right. So, you may not need to remove your wisdom teeth if they are
Healthy.
okay. What does that mean, healthy?
Yeah.
Like no cavities, healthy?
No cavities. They're in the right place in the mouth.
Mm-hmm.
They're actually a chewing surface, just like your other teeth. They're in alignment.
Mm-hmm.
You're able to clean them properly. You can floss back there. But that population, the number of people, if I had to guess, is less than 5%.
Less than 5%.
I would say less than 5%.
You know,
And
I have my wisdom teeth. Do you guys have yours?
I don't.
I
don't
got
have my
all
wisdom
4
teeth.
out.
Okay.
I had mine removed at 18, I think.
That's why you're wiser than us.
Well, I don't know.
That's funny.
I have a bigger mouth, so I have more space. I'm able to clean them. But you had them removed. Why?
I had mine removed before they were even fully erupted because...
Was that a decision you made?
yeah,
or?
that was a decision I made.
Wow, at 18? I wouldn't even know.
Yeah. Because I was like, because I've heard like horror stories of like wisdom teeth and like, that was the age that a lot of people were going through it.
Well, you also saw me go through it when...
And I saw her go through it.
Yeah.
And
You're a pretty wise 18-year-old. At 18,
I was
my
pretty...
parents
He's
were-
actually the wisest out of the 3 of us, by the way, just to let you know.
That's a
He's-
scary little...
That's a tidbit.
I remember I was
Scary.
18.
He's
my
the oldest, and
Yeah.
he's the youngest, and he's probably the most mature and the wisest.
Well, I don't know. It depends on the day. Depends on the time of day. Depends on the season.
No, Rashad, you're very mature and wise.
I am.
Sometimes.
Thanks.
Okay.
But
Gibran said we all have seasons. Like,
Yeah.
you know. So
It's yeah.
I
I
just-
have my season too.
I just took the energy now to like
Oh, okay.
serious, huh?
All right, yeah.
Heidi's like, okay.
Okay. No, I'm agree.
He's kind of like me with my siblings.
Which is, I feel like that's, you know, I'm saying that's okay. That's why I say, are you the eldest? Because I'm like, it seemed like you were the way you were, the dynamics of it, in a good way, I feel.
But back to the question, like I had a lot of my friends going through it. I'm like, okay, now's the time to go through. I didn't understand the reasoning like that I know now. But if I'm like explaining it to someone, you know, when you're younger, they come out a lot easier. Like, why do wisdom teeth need to come out? It's because usually the mouth is small. They don't come out normally. Infections can happen. You can't really clean back there. That's why infections can happen.
Yeah.
And it's just better to take them out.
But I have an issue with the fact that I'm not a robot. Not everyone needs their wisdom teeth out. I mean, if they don't satisfy, like if they can keep them healthy, if they're using them to chew on them, if you know, if they're putting them to use, then why take them out? So the fact that people are taking them out when they're super young, where you don't really know how the occlusion is going to come out, what's your thoughts on that?
Based on my experience with wisdom teeth, and I've taken out wisdom teeth from all age groups, like I said earlier, there's about 5% of the population, I would say, that have healthy wisdom teeth at an older age that are cavity-free in the right position.
Yeah.
So I'd rather take them out when they're younger. What are the chances that you might be a 5%er? And even if you are,
I am a 5%er.
I disagree.
actually,
I'm
you
not?
Disagree.
in my opinion, you do need your wisdom teeth removed.
Why?
Yeah, I think so too. Both of you now do.
Why?
Okay?
I know, I definitely do. I'm completely.
I have a
Can I tell you why?
Sure.
Because you have a lot of fillings in your mouth. That means you've had cavity. You're high risk for decay. So if you're high risk, correct me if I'm wrong.
Yeah.
If you're high risk for decay with some of your front teeth, you're at risk for decay for your wisdom teeth. And you probably do have decay on your wisdom teeth. You're just hard
Who does
to
his
work on
teeth?
sometimes.
She does.
I do my teeth.
And who does your teeth?
They both do my teeth.
And who does your teeth?
Both of them.
We both do.
Okay.
So
Just
you're
curious.
saying-
I have the ability to headlock him because he's very annoying to work on. I love him to death, but when he gets in the dental chair and I'm his dentist, I need to sedate him.
So I worked on him once, and
He's like, I'm done.
and I was like done after that.
True
You know what
story.
he did? He got the mirror and he started taking my hand and moving in the direction of the mirror. And I'm like, you're the patient now. Play patient. I'm the dentist. So,
That's
yeah,
funny.
he was a little bit annoying.
Don't give him the mirror. Just say you can't look.
I prefer to be sedated when I'm worked on. I don't like to be awake.
Maybe that's
because
the
I do know that I am,
Yes.
as a patient, I'm a pain.
But you're a sweetheart and everything.
Thank you. So okay, so you're saying that because I have had cavities in the past, it's better for me to get my wisdom teeth out.
Yeah.
Because if I'm like 70 years old and I have to have them out, then
And most likely, because they start breaking down, you get a small cavity from the back. It spreads. Like Rody said, even I don't remove wisdom teeth anymore. I personally don't enjoy it, so I don't. So I give everything to.
Excuse me, like, do you enjoy it? Is that the thing?
Oh, I love taking
Oh
out
my
wisdom
God,
teeth.
that's-
Like,
what do you love about it?
I
I
He
love.
just loves it so much he can't even talk about it.
Sadomasochist?
I was like thinking like,
so I love blood.
What?
this is like we're live right now. I don't know.
But we did say it's going to be raw and unfiltered. So
Hey, so I love seeing blood and I love taking out teeth. It just makes me happy. It's
This is all. We need media training after this.
yeah,
Okay.
we need a publicist.
No, I think what he he's trying to say, Brody's personality is more like, let's get it done and move. With wisdom teeth, you remove the tooth and you're done with the root of the problem and you can go on with your life.
So it's immediate gratification and
Immediate
immediate
gratification.
solution.
He doesn't mind blood. It will get bloody sometimes when you're doing a surgical procedure. And
I know dentists who don't do surgery because they don't like blood.
At
They
all.
just do like fillings and,
Yeah.
and crowns
So
and
he
stuff.
doesn't mind the blood, but he likes to get rid of problems from the root cause and then done. On to the next problem. Me, I love Invisalign. The reason I love Invisalign is because I love people. I like to constantly keep seeing them. It's like I'm married to the person for a year. Like I saw her all the time.
Yeah.
It's incredible. He doesn't like to get married to anybody. I just
So I'll tell you what I don't like doing. I don't like cosmetics, or doing like work in the front because people can be picky, like they want this a certain way. I just like to get in, get it done.
Yeah,
and
with
just be
Steve,
done
it's like
with it.
it's
And
binary.
that's why he's the most calm, because he avoids dealing with
With the headaches.
With the
I
headaches.
try
Yeah.
to minimize my headaches
Yeah.
because there's a lot of headaches in life, and I'm not saying like that's a bad thing. That's just part of
life.
Part of life, but you want to decrease as many
Yeah.
as possible.
And you do what you like, and you see a problem, you remove it. It's very binary, and that's it. And some
Exactly.
people, they like the process of making things, building, and you're just like,
Exactly.
No, I don't.
Cool. So are you ready for the 1 minute or less challenge of?
Sure, let's do it.
Okay, so I'm
What's
gonna.
the question? Repeat the
The
question.
question is gonna be, should you remove wisdom teeth as prevention if nothing is wrong? Ready?
Yes.
And boom.
So I do believe that you should take out your wisdom teeth even if nothing is wrong at the earliest age possible. And the reason for that is when you're younger, your wisdom teeth are easier to come out, you're healthier, so you'll have less post-op complications and just things go smoother. If you wait until you're older or until like you're very old, like you're usually on medication, you have health issues, and the process just becomes more tedious and more complicated. I have patients that are on blood thinners that need their wisdom teeth removed, and you have to talk to their medical providers. So just take them out when you're younger.
Awesome. Thanks for that. That's you still have 16 seconds, and I'll put my 2 cents in. I feel that if your teeth are healthy, if the crown is grown completely in, fully erupted, if they're positioned correctly and you're biting on them, and if you're able to keep them clean, then maybe you can delay them a little bit.
And I totally agree with you, but the percentage of people that have all of those 4 bullet points,
5%.
less than 5%.
Got it.
and also there's no side effect, right? If you remove them.
No.
So might as well if
Yeah.
there's no side effect.
Yeah. So
Evolutionary, we're gonna all start going to 2 molars. You know that. We
But
used to have 4 molars.
Why do we have them in the first place if they're useless?
Because when we were Neanderthals,
Yeah.
like literally,
Yeah.
like I'm not making this stuff up.
I was a Neanderthal.
You don't want to go.
in the olden days, we used to need 4 molars to chew all our food because we didn't have. We needed to
was
chew.
tough,
It was
like,
tougher
yeah.
to chew the grass, and it's not like we had all the cooking that
Yeah.
we have now. We had to go and hunt, and
Yeah.
like you needed those molars.
What did we do?
We needed the molars.
Okay.
Over time, we started losing the 4th molar, and we have 3 molars. And now we're losing the 3rd molar. There are some people without wisdom teeth
Really?
that are being born.
Yeah, I know a
and
few
we
people.
have one patient in the office that has 4 molars. He's getting 2 and 2, 2, 2 removed.
Yes, he's a freak then.
He's a freak. He was the king of the
He
Neanderthals.
was the king.
Is that the first time you've seen someone with 4
It
molars?
was the first time.
Wow, and most people have 3, and you've now seen younger patients with 2?
Yes.
Okay,
Yes.
interesting.
I actually told him, I'm like, you're less evolved than all of us, but I'm sure you're very smart. But and he started laughing. And then he told me he researched it, and he said I was right.
He's a medical doctor, right?
I don't know what he is.
Okay.
He's a cool guy, though.
Okay.
Yeah.
Awesome. So there you go. That's the wisdom teeth segment, and we can close it off with this.
I think next time or the next show, maybe if we close something, say make sure if you like us, tune in next time. I keep telling you, like.
Yeah, wait, the energy, keep it for.
Awesome. Welcome to this segment. In this segment, you know, Rodi and myself were super proud of our sister, Dr. Lydia. She, you know, she's a mother, a wife, a dentist, a daughter. Just being a mother is challenging enough. I babysat my niece for a couple of days. And,
How was that?
I scheduled a vasectomy the day after. So I see how demanding it is, and then, you know, and I understand her a lot better. So this video, you know, we did this video, and let's take a look at it, and it's a little bit about the life of Dr. Lydia.
Pretty laid back, relaxed person, but very hyper and outgoing, and I just love to live life and spend time with the people that I love. My daughter, my husband, my brothers, my family members when they come into town, and just experience life to the fullest. I'm Lydia Riman, and I'm one of the 3 sibling dentists at our dental group. I actually fall right in the middle. I am very busy, and it was really, really difficult for me at first, because when you have a child as a mother, it is the most beautiful thing in the world, but it is the hardest thing in the world. And I don't feel like enough mothers talk about how hard it is, especially if you want to maintain the person that you were before, which you'll never be. You're gonna be a better version of the person that you were. I spent a lot of time and effort and money going into dental school, and I'm really passionate about my career. I love dentistry, but I feel like it's very important for a mother to maintain her passions after she has her baby, and her baby's just going to be so proud of her. We're Lebanese, and we grew up in Saudi Arabia, on an American base in Saudi Arabia. It was a very, very beautiful childhood. Our closeness, I think, stems from our parents and our family and their extended family. Our parents took a huge leap of faith and risked everything to bring us here and to make sure that we have the best childhood ever. And Rashad, Rodi, and I decided that we were going to be tight no matter what, that we are going to really have unconditional love for one another, regardless of what we choose or what we are and what we aren't. We are the first dentists in our family, and when we moved back to the States, Rashad chose dentistry, so then I started exploring optometry, dentistry, medicine, and dentistry radiated the most with me. I loved the intimacy of it. I loved working with people, seeing different people. I wanted to be the best dentist that I could be. I wanted to touch as many lives as I can possibly touch. Rashad, Rodi, and I, we're in it for the long run. We're not reinventing the wheel. This is how healthcare should be. They should expect a high standard of care. They should expect their dentist to do an oral cancer screening and take a look at their tongue and their neck and their joints. They should expect nothing less than the experience that they get from us. I just feel very blessed and fortunate and very grateful to be in the position that I'm in, to be able to work with my 2 brothers who are in the same field as I, to learn and to grow with them, and to build something that has purpose and meaning in life. That is something I don't take for granted, and I'm grateful for every day.
Lydia?
That was a great.
Making me cry. I haven't seen that video in a really long time. It's really beautiful.
It was a great video.
Yeah. No, I admire how, you know, strong and powerful women are, and having seen my mom and seen you and the demands that are on you are huge, and yet you keep creating. So you're not just a dentist, you're an entrepreneur, and you and Dr. Rodi here have created something called Cora Care. Can you tell us a little bit about that? Tell us about, you have a candy line that you just released, and there's, you know, just tell us more.
Sure, thank you. So motherhood really changes you, people. So I had my little Julia about 3 years ago now, and just watching this movie, she was a lot younger when we shot it. She was about a year and a half, so it's been about a year and a half. So after I had Julia, I went through a very difficult time mentally in my life. I was very depressed. Like if I didn't have the love and the support of my family, especially Rashad and Rodi next to me, they were always there. They were helping with Julia, and I went through a hard mental state for the first year.
You experienced winter.
It was a dark winter. But I'm so blessed for that dark winter because I also discovered a great opportunity. And I lost the front tooth during my pregnancy, and we'll show a video of that later. I don't know if we have it on set right now.
We do.
We do. So I lost the front tooth, and while I'm like taking care of that, Rodi's taking care of my daughter, and Rashad's taking me to my husband's taking me to the doctor. So it was really messy. It was just like, oh, there I am with no front tooth.
Hi everybody.
I
Today
look
is
so
a very
sexy.
big day.
Can we have the video for the no front tooth? Can we play that?
Well, I had a temporary.
Wait, so this is
play
not
it
your
off.
teeth right now? This is not your tooth? Wow.
Hi everybody. Today is a very big day.
We should have this on
I've
Care.
been rocking this look
I'll talk to you
for
about
a while. I had a temporary.
Pretty without a front tooth.
But I
She looks
did
kinda
rock
like-
this
So
for
if
good
they need
4
a
months
female version of the
after
hangover guy,
the
they
implant
can
got
hire me.
infected when I was pregnant.
Because
So I
that's-
shall
that's
no
no front
longer
tooth.
hopefully ever need to
yeah,
rock it again.
I look.
I'm
really
getting the
cute.
final.
Yeah, very.
How did you feel when you, I have no expectations, but how did you feel as a dentist and then you lose your tooth? How did that make you feel?
I mean, it was very hard because I was throwing up between 7 and 14 times a day for 8 months straight during my pregnancy with Julia. So that really, like, I was seeing a patient once and I threw up while I was seeing him, and Rashad had to finish the filling.
Oh, not on him, I hope.
Not on him. No. It
That
came
would
out
be-
in the mask.
Okay.
Yeah.
Okay.
True story. But it was also my husband's friend. So I started working, when that was happening, I only worked on people that I knew very, very well
Yeah.
personally. And I told them I may be sick. And they're like, we don't mind at all. Like, that's fine. And I only worked when I had one of my brothers with me because I needed backup. So it was a very tough time, and when you have a tough time, you can either go into more tough times or grow from it. So I decided to see an opportunity there. About 60 to 80% of women who get pregnant and proceed to give birth, they have dental implications with their gums, their teeth.
Complications.
Complications or implications.
Implications.
Because some of the implications are reversible. They don't get complicated. I got a complication. So if you want to check out a lot more information about this, I'm not going to get into it in detail. You can check out our website, coracare.com, which Heidi's team has built for us, and we're still working on, but it looks very nice, and I'm very happy with the appearance of it and functionality. So I started serving women on Facebook, on mommy groups, when I'm up at 2 a.m. breastfeeding and feeling miserable while breastfeeding. Like,
So
breastfeeding
you
wasn't
started
for me.
looking at Facebook groups of
Yeah.
mommies to see
I just wanted
who's
support.
sharing it. Like, yeah, okay.
Yeah. So the first Facebook group that I went on, LA Mommies, I posted, hey everybody, who's had any dental implications during your pregnancy? Because you also snack in the middle of the night a lot. You eat a lot of carbs. I wasn't able to brush my teeth properly. You guys have witnessed that recently.
I witnessed that. May no one out there witness that.
I'm unable to brush my teeth properly. I'm pregnant right now with my second child. So in one night, I got about 70 responses and
Wow.
80% of those responses had a root canal, a cavity, an extraction, gum disease. So I started looking further, and I started talking to my brothers about it, and then long and behold, gum disease has been linked to premature labor and lower birth weight. So I'm like, there's an opportunity here. And I started talking to more women, and they're like, yeah, I got a cavity when I was pregnant, and then I didn't go to the dentist because I thought it wasn't safe. And then, no, it's safe to go to the dentist when you're pregnant. So long story short, a lot of things happened, and then I was talking to my brother one day, and then we decided, let's do something together, build something together to combat this problem. And my daughter got hospitalized for the first and hopefully the last time in her life when she was about 1.5 years. and I saw a lot of sick kids in the ward. And I can control, as a dentist, I can educate about dentistry with children. I can't control, God forbid, cancer or any other disease. So I wanted to create a candy that prevents cavities, that these kids in hospitals and anybody in a hospital or anybody in life can enjoy without getting cavities. So Rodi and I started talking to the right people, and we built this together.
How long did it take you from the time you like came out with a concept to like the first candy batch came out as Little Jewels?
Oh.
How long was that?
So the first concept of Cora Care and the whole prenatal dental care came out when little Julia was about 4 months old. That's when I hit the peak of my depression, and I'm like, I need to be a good mom for her, and
Yeah.
if I go down that route, it's ugly. I've seen it happen. And then I got my first bag of, when did we get our first bag of Little Jewels? In January. So,
Yes, I
so
remember.
so it was about a 2.5-year process.
Yeah.
And we were in research and development for about 1.5 years. And our candy has coconut oil in it instead of palm oil. Most candies have palm oil, and palm oil is not good for you, especially the ones they put in candy. And it's made with sugar substitutes called sugar alcohols that the bacteria, the bad bacteria in your mouth, cannot break down. And we have 4 flavors, and yeah, I'm very, very proud of it. We'll show it in a bit. But Heidi was the first customer.
Yeah,
so
we
Heidi,
had a video.
Heidi, we do have the video that I don't have here. So Heidi's marketing and communications team, they're handling all our social media and our website and all of that. So you can find a lot of information on our website. But do you want to go to the candy section on the upper left?
You can go to my screen. That's actually the website.
Yeah.
And that's the candies.
Those are the pictures of the, but go to the upper left to the candy icon, and then click on that, and then you'll see, yeah, so that's the Little Jewels bag. So I named it after my daughter, and we had a nice...
It's sold out.
It's sold out. We had a nice stash in the office, and within 2 weeks it was all sold out. So, and Heidi was the first customer.
So I got the first bag at your office, and I think literally the first customer. I was so excited, and I ate them, and I really liked them. There was 4 flavors. I really love the green apple and the cherry. Those 2 are my favorite. And then I got home and I put it on our like shelf in the kitchen, and my partner, he's like, "What is this?" And I'm like, "Oh, it's really good." I didn't even tell him, you know, where it was from. Like, it's really great. And then he started eating them, and then in 2 days it's finished. And then I got mad at him because I was like, "That's my candy." And he's like, "Just order some more," and I'm fine. And then so I actually placed an order, and someone canceled it, and I'm like, you know, maybe it's a mistake. I'll do it again. And it got canceled again. And I was, you know, and finally I think I told you, and then you thought, "Oh, I thought you were just testing it." Like, no, I really, if I wanted to test it, I would not have gone through the whole process, but I actually do it twice, so.
So Rodi was telling me, "Dude, Heidi keeps ordering orders." And I'm like, "I think she's doing it by mistake." He's like, yeah, I already.
So I would cancel her orders because, like, you know, she's working on our website and everything, so I thought she was just going through the user experience. I was like, maybe
No, I mean, I was, but I'm like, I didn't have to go through the whole thing. And I'm like, why would I order, like, you know, every time I order, I think I ordered 2 at a time. And I'm like, I did that because I really wanted it. And then I got canceled. But
So you and your partner like the candies?
you know, he asked for it now because he's like, "What happened to that candy that you said you wanted?" And then like, I'm like, "Oh, long story." I didn't want to explain the whole thing. Like, it's sold out. And he's like,
We'll have some in stock very, very soon. In the next couple of weeks, hopefully. But,
That's awesome. So
yeah.
I even brought it to a conference. Like,
yeah.
she was texting me. I'm like, "Look, I have your candy with me." It's like the last cherry 2 of that I have. I brought it to the conference. I didn't want anyone else to get it.
Yeah.
That's
So-
so great to create something from nothing.
It's really good.
and have it bring people like joy and actually a health benefit.
Yeah.
Yeah.
And that's what I wanted to do.
So-
and that's yeah.
I guess my question is, when is it not going to be sold out?
So it's not going to be sold out. When do you think?
I'm hoping within a week.
Within a week, we'll
Okay.
have a large stock. that's
within a
there
week.
for everybody.
Okay. And it's available on your site and also on Amazon?
Correct.
Okay.
And then I promise I will not cancel any
Yes,
more
no
orders
more
from you.
Like, you should know, I am not like, you know, when I do something, it's really intentional, especially if
We'll send you and buy a bag as a gift for canceling like your many orders, poor thing. But yeah, I'm very excited about Little Jewels because we've gotten such amazing feedback. People are loving the candy. Everybody has a favorite, but
I'm surprised that, you know, one of the things that you told me, and again, maybe because I don't have a little daughter or little, you know, kid, but how come that there's very few products like it out there? To me, that's surprising, since they came out with everything.
In some countries, like in Europe, it's way more popular
Yes.
over there.
So do you have similar things in Europe, but not here in the States?
Yes.
Yeah.
Okay.
So
That's pretty amazing.
in Europe, they've been using sugar alcohols and xylitol for many years, especially on pregnant women and students.
I actually
children.
am very familiar with it, and I didn't know that in the States it was like rare, because in Asia or, you know, in Europe, in the UK, I see it all the time, like
Yeah.
xylitol.
Xylitol.
So I didn't know
So,
that.
Hopefully, in the United States, prevention is worth an ounce of cure.
Yeah.
And I prefer to make money preventing something than drilling on people's teeth and
Yeah.
extracting their teeth. You know, I'd rather work on Invisalign and improving their smiles versus drilling on cavities, especially on children, because it really traumatizes them.
Yeah.
And if you can prevent that from happening, why not? And if you can enjoy a piece of candy without fearing cavities, why not?
So you're only
it's just
supposed
an
to eat.
opportunity.
Okay, so how many are you supposed to eat a day?
Okay. So like anything in life, even this candy in moderation, you will not get dental cavities if you eat a whole bag, but you may get diarrhea, which may not be a particularly bad thing, but that's like the worst thing that can happen. But I think if you eat a whole bag of any candy,
What's
you may have diarrhea.
what is a good number?
What is it? I mean, one serving is how many pieces?
I think 4 to 6.
Yeah, about 4 to 6.
Okay.
Maybe a couple servings tops.
Yeah.
Like
I'll probably eat like a dozen throughout the whole day.
okay, all right.
You'll be fine.
You'll be
Yeah.
fine.
I think even if you eat the whole bag within the day, I think you'll still be okay. But if you start eating more, then it'll get bad. But
I like to say 2 servings. a
Yeah,
day.
I mean, I try to not eat like, you know, a whole bag in a day, just because I don't want to scare people.
Yeah.
But I usually eat like between 5 to throughout the day, you know, once
Yeah.
every couple of hours or
And
something.
it really satisfies also your sweet tooth. And the
Yeah.
amazing thing about this candy, this is really good for people who have dry mouth. As we age,
Yeah.
our mouth dries out. We take medications, certain diseases. If you have radiation and chemotherapy, that dries out your mouth
Yes.
big time. And this candy, it just helps you, just gives you a good taste in your mouth, stimulates your salivary glands if you have any remaining after chemo and radiation. So, but it won't give you cavities, because a lot of these patients get a ton of cavities after their medical treatment. So there's a lot more information on my site about this. Rhodey, I'm sure, can say a ton more, but yeah.
Awesome. Well, I'm super proud of you. And
Thank you.
Which one of the videos on your site were you interviewing people on the street?
Oh, okay. Go down. This, go to YouTube.
Oh, it's on YouTube?
Yeah.
Oh, okay.
Correct hair. So what I did when we first got our samples, Rashad, being the very vibrant brother who always is full of very, very different ideas, and he brings a lot of ideas to our family. He was like, why don't you go down in the street and start giving them randomly to people on the street? And I'm like, dude, nobody's going to take random stuff from a stranger that they don't know. He's like, you'd be surprised.
Especially wear a white coat, to be honest. You can get people to do.
I was wearing my scrubs. I didn't wear a white coat.
If you look like a doctor, people would do
I
stuff.
looked like a doctor. I think in one of them looked like a doctor, and the other 2 I looked normal, which I think I should have looked like a doctor. But people took the candy from me. Like
No, it's true. Like, if you wear a white coat, people will do anything. Even though it's nothing to do with like medicine, like you tell them to go left, they will do that.
Yeah, that's true. So it should be on. Did you put Coric care? One word.
One word?
Yeah.
One word?
Yeah. So hopefully, welcome to Quark here. Down, 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 down. Is there a next page?
We got a lot of nice videos on there, huh?
Yeah, I guess they haven't put that one up.
Okay.
Yeah. I'll send it to you and then, yeah.
I have a lot of videos. So you were interviewing people on the street?
And that's just with our samples, and people love them.
Yeah.
Yeah. So it's
No, I tell you, it's great.
yeah.
It tastes really great. Like I was even, I don't know if I told you, but I said maybe, who knows, like actually the market is everybody, because it's a good candy, and I eat it just personally because sometimes you just like, I get dry mouth and I just want something to chew on, and it tastes really awesome, and I'm like, I guess like I'm not feeling guilty because I feel like I'm not like making myself have cavities.
And
so
this type of sweetener, the sugar alcohol, won't cause spikes in your insulin as
Ah,
well, which
I
is
see.
really good. So even a diabetic can enjoy a piece,
Nice.
and it won't impact them. Obviously, they can't enjoy too much, but even a piece or two for a diabetic is a treat.
okay.
Yeah. So thank you for your testimonial.
Yeah, I
and
didn't
for
know I was
telling
doing a
it.
testimonial. I was just complaining that my artist got cancelled. But yeah, that's a testimonial.
You will have it soon, and your partner will have some soon too. But thank you so much.
Awesome. Well, that's great. Let's take a break, and then we'll be back. After this break, we're going to prepare for the next segment for you guys. If you're watching this right now, we are recording the Dental Buzz Show live, so you're getting behind-the-scene access to what's going on. You'll see us messing up. You'll see us saying things that aren't necessarily PC, but that's okay. That's that's the reality of how things are, and we appreciate you for being here. And we'll be back after these breaks.
Everybody, this is Dr. Lydia. I'm on Rodeo Drive in Beverly Hills, and I'm asking people around here how they feel about the dentist. So follow me, let's go. Do you like the dentist?
No.
Do you like the dentist? Not really. Do you like
Premiumbeat.com.
Hi everybody, this is Dr. Lydia. I'm on Rodeo Drive in Beverly Hills, and I'm asking people around here how they feel about the dentist. So follow me, let's go. Do you like the dentist?
No.
Do you like the dentist? Not really. Do you like the dentist?
Not really.
Do you like going to the dentist?
Oh, I haven't been in a while.
Maybe you should go. Perfect, you have braces. Do you like the dentist?
No.
You don't like the dentist either?
No, well, I go when I have to.
I hate dentists.
Why do you hate dentists?
Well, because they just give pain.
You know, like nails on a chalkboard?
Yeah.
Everything that you do in there feels like that to me. Honestly, when I walk into the dentist, I cry.
Oh, okay. Why?
I don't know, it gives me a nervous feeling. You know, like the drilling sound? Oh my gosh.
Do you think flossing would help so that you'd avoid the pain?
Probably not, baby. I'm 60. See, I just look like this. You know, if I make it around 20 more years, you know, I think I got enough teeth to last me.
Do you floss your teeth?
No.
Do you floss your teeth?
Nope.
You don't floss your teeth?
Nope.
Never.
I've flossed before.
If there was a candy that you could eat and won't give you any dental cavities, would you be more prone to eating candy?
Yeah, of course.
What if I told you there is a candy that won't give you any dental cavities? Would you want to try it?
Absolutely, yes. If I will find a candy that doesn't damage the teeth, I will definitely eat it.
What if I told you there's a candy that won't give you cavities? Would you want to try it?
Yeah, I would.
All right, so I have some for you here.
Very good. Tastes like an airhead.
It's like a Tootsie Pop.
So you like it?
Yeah, it's really good.
Like an apple kind of.
Uh-huh.
It's green apple.
It's a green apple, exactly.
Good.
Good?
Yeah.
Good. Green apple. I really like this.
You like green apple?
Mm-hmm.
So this is the chocolate flavored.
It's good.
Do you like the taste?
Yes, absolutely.
Yeah?
Very nice.
Yeah?
Is it candy?
Yes.
Or
Yeah,
Yeah.
you chew it.
it tastes good?
It tastes
It's
good?
sour?
And this can't give me cavities?
This will not give you cavities. So there's no sugar in there. It's a sugar substitute. It's made out of erythritol and xylitol. They're naturally found in birchwood trees and corn cobs. So this kind of cleans your teeth. It causes more saliva to be produced, and it doesn't give a substrate for the bacteria to produce acid. It actually starves the bacteria. Well, it's sugar alcohols that cannot be broken down by the bad bacteria in your mouth, so it won't give you any cavities.
That's awesome.
So this candy won't give you any cavities.
Oh, really?
And as you can see, it'll make you salivate a lot, and saliva is very good in flushing your teeth out.
That's great. Yeah. Wonderful.
Refreshing, you know? So I feel like my mouth's clean.
Yeah, awesome. Well, thank you so much.
You're welcome.
As you can see, not very many people like the dentist, and who would blame them when they go get their teeth drilled on? But good news is, if you visit your dentist often, you take care of your teeth at home, and you enjoy that occasional piece of candy that will not give you cavities, you will enjoy going to the dentist, I guarantee.
Try some, all right?
Let's do it.
Let's do it. So I'm going to open up a fresh batch.
I like cherry.
my lavender.
You said cherry?
Yes.
You said lavender?
Please.
I want chocolate.
Chocolate.
Yeah.
So look, what I'm going to do is I'm going to have you reach into the bag. I'm going to shake it, and then we'll see what you guys get. And if you don't get what you want, then we'll
Pass.
switch.
Okay.
Yay.
So, it's beautiful packaging.
Yes.
Okay. So,
Don't look.
No look.
Peeking.
Green apple.
Apple. I like apple.
Oh, there you go.
What did you want?
Cherry.
Okay, keep going. Chocolate?
I'll take that.
Guess you'll be eating another.
Okay.
Okay, let Gina pick.
Let
She'll
Gina
give me her luck.
What do you like, Gina?
She likes lavender.
Lavender.
Another one?
What is that?
The green apple.
Apple?
Yeah.
It's my day. I love apple. What is that?
Oh,
Cherry.
It's yours.
Cherry.
You got a cherry.
You
Your
need-
turn, Dr. Rodi.
Okay.
Get one for me.
All right.
Lavender.
I'll get one for you. I'm going deep. Okay.
What did you get? You gotta name it.
Red apple.
Red apple? Red apple?
Cherry. I guess there's no lavender in this bag. There's like no lavender.
Maybe the lavender is at the bottom.
Is there any lavender in here? No.
Is that a bag with no lavender?
Oh, there we go.
There we go.
Okay.
Lavender.
Yay,
So
finally, I got
let's
my
put it to the camera. Right there, and we'll put it together, right? So this is my apple.
Cherry.
Lavender.
Chocolate.
Let's go for it. Let's do this.
Let's do this. Let's eat it with gusto.
I love it.
I'm in heaven. My favorite.
I'm happy I have 4. Awesome. So welcome back. I'm joined right now by Barbara, dental assistant extraordinaire, and by Gina Lopez, our treatment plan coordinator, and my brother.
Dr. Rody.
Dr. Rody.
So what do you guys want to talk about? What's buzzing in your heads?
Well,
What's buzzing in your head, Barbara?
I don't know.
You want me to ask you a question?
Yeah, ask me a question. Anything.
What is your favorite procedure in dentistry
Oh,
to assist with?
I would say implants.
Implants? Why?
It's interesting. It's not just sitting and like a filling. We do those all the time, like pack them behind our head. We do implants all the time as well, but it's a case by case. Like every implant is different.
Okay.
You see a lot of blood, you see the bone, you see things that you normally don't see on like a filling or a crown. I mean, you're seeing a tooth all the time, but with implants, it's something different. So I like to get in there and actually see what the doctor is doing.
Awesome.
You're really good with assisting with implants.
Thank you.
I enjoy it. I love it.
Yeah. What do you enjoy the most?
I love doing implants,
Yeah.
bone grafts. I enjoy doing cosmetic cases.
I know you do, especially veneers. I can tell.
I like mocking up cases, you know.
Mm-hmm.
I will be a patient soon.
Yeah?
Her filling
My
popped
veneer
out.
came off.
Well, we're here
My
for you.
veneer, yes.
We're here
Can't
for you,
wait
Gina.
to be on the chair.
Yes. Gina, how many years have you been in dentistry?
Oh my God, I hope it won't show on my face. Almost 20 years.
20 years? And how has that profession been for you?
I really like, working in this field. Way back in the Philippines, I went to College of Dentistry. And then, of course, stories changed when you came to America. So anyway, I decided to be in the field, and I really like dealing with patients, caring for them, and, helping the doctor understand the importance of dental health. Yes.
So you help out, you help us out, and you do a great job at it. You do treatment plan coordination and financial arrangements for patients. And so usually you're the first person that a new patient gets introduced to.
Correct.
Can you take us through the process of how you take in a patient, schedule them, we see them, then,
Right.
you just take us through that flow so that people who are considering going to the dentist, they kind of know what's a natural flow that to go through.
Of course, the first contact would be on the phone when they call. So I want to make sure they are really welcome to our office and, answer all the necessary questions that they have and schedule them right away for them to meet you.
Excellent.
For you.
Okay.
And, when they get in, I welcome them again and help them with the paperwork and get them settled for you to meet the patient.
Awesome. So there's when a new patient comes in, there's first they fill out some information. We need to know their health history. We need to know things to make sure that we have a complete picture of what their goals are and what their past history is with regards to their health and dental health. And you take care of that with an iPad, right?
Right.
It's paperless right now?
Paperless office in our office. You would love it.
I feel Gina is like the quarterback of our team. So she basically is, I don't want to say she's at the center, but she's the quarterback. She throws the ball to certain players when they're,
when it's needed.
When it's needed. So she guides the flow, and that's a very, very important position.
You know, I can't agree with you more, because to have someone there, as a dentist, I love just focusing on the dentistry. But the reality is that the dental business, you gotta focus on the dentistry, you gotta focus on the paperwork, and if you an office that takes insurance, good luck. And there's so much going on. So to have someone that you can depend on and trust to not mishandle your patients, to talk to them kindly, to listen to them when they're talking on the phone, see what they want, and to guide them into the office, and is very important. So thank you for adding that value to our office, Gina.
And thank you for appreciating my work.
Of course.
I feel so lucky to be with you guys.
We're lucky to have you. And what I love about Gina is a fashionista. Like, she comes every day decked out. And Gina, can you tell us a little bit about what you're wearing today?
Okay. I'm wearing a spring skirt. As you can see, the pastel colors at the bottom.
They won't be able to see that. The bottom. Take our word for it.
It's pleated. And, as you can see, we're all in stripes.
Let me see that bag. Move it away, because I think it's
just,
covering.
To complete your look, I always want to make sure I have a blazer on.
Medium shot.
So that way, I'm really a guide of the office.
Nice. Nice. So you got the blazer, you got like a semi-turtleneck going on there with stripes, and you got
it's a spring look with a Gucci belt.
You got a G belt.
Gucci.
Gucci. Yeah.
Matches my earrings.
And earrings, pearl. So your earrings are matching your belt.
With my pearl bracelet as well.
Nice. And is that Tiffany there? You're wearing some Tiffany bracelet?
This is Tiffany from the Philippines, by the way.
Filipino Tiffany?
Philippine pearls.
Okay.
Wow. Really?
Proud to say, yes.
Awesome.
Hey, the Philippines, they have a lot of pearls, right?
Oh, yes.
Yeah.
Yes.
Nice.
The best pearls.
So I think it's important when, Gina's the first person that patients see.
Yeah.
So she greets them well, nicely, with warmth. And, looks matter. She's always dressed nicely. And I think people and patients resonate with that.
I agree with you. I like to be more relaxed and, at times not maybe dress like I'm in a GQ magazine, but the more I go through life and the more wiser I get, the more I realize that people will judge you.
Based on how you look.
Based on how you look. And that's only natural. I mean, I probably judge people based on how they look as well.
Maybe subconsciously. You might not do it consciously.
Yeah.
Right.
So it's super crucial for us to always look tip-top. And thank you, Gina, for setting an example for us. Whether it's a difficult day, a sad day, or a happy day, you put all that behind you. You walk in the office, makeup, and dressed very nicely.
Thank you for noticing my fashion.
Of course.
And my thing is, whatever happened last night, get up, dress up, and show up.
Get up, dress up, and show up,
baby.
And
That's
leave
right.
everything behind the door.
And leave everything
of
behind.
Street 325.
I like that. I usually tell people, when you walk in through the doors, you leave your personal life behind. When you leave those doors, you leave work behind.
Yes.
Well, I think think about work.
Yeah, but
Man, I gotta go and stock. No. Man, I left that room dirty. No. I do though. Think about it.
It's always tomorrow.
Yeah, she'd always tell me, "Go, Barbara. It's always tomorrow." Okay, Gina, I'll leave it.
Yeah.
Gina, you've also I enjoy how active you are on social media as well. Can you tell us a little bit about that? You've always been that way? You've always did Snapchatting, Instagramming, Facebooking, all these things?
Yes, I do that not to, not to be show off, but to influence other people, like what I do, my family, like all positive things, not like, oh, someone passed away, blah, 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 or got sick. I always post, positive vibes only.
Positive vibes. And do you ever feel scared or not confident to post, or you share freely? I notice.
I share freely, but I also make sure I look good.
You look good. So
If I don't look good, I delete.
But you always look good, I feel, because you're always sharing. Like, I see your Instagram, and like on the weekends on your stories, you post pictures of your families, of gatherings, of food. So you're always looking good.
So yeah.
And you're always like your energy, I feel, is high, and that you can tell from your Instagram.
Yeah, that's me.
And I can tell you're a family person. You care about family a lot. So we can tell where your values are, and that's important.
And at work is my second family, and you are my family at work.
Yeah, because
professional family.
Yep. Because you spend so many hours in the office.
Exactly. Yeah. We spend more time.
Sometimes we spend more time together than with your actual family. So it's important to work with people that you like.
That you like, and you are liked and appreciated.
Correct.
Awesome. So thank you, Gina. Thank you. We just want to let you know that I feel good going to work each day and being surrounded by good-hearted people like yourself and Barbara who have a good work ethic, and it helps us be better each day and look forward to things. So thank you for bringing that, and we realize life can be tough at times. So thank you for being tougher and leaving that stuff behind and coming to work, both of you, in top shape. Thank you. Next, we are going to talk about a procedure that yours truly invented. It's called the Glam Gums procedure, and I actually did this procedure on Barbara here. If we go to the computer screen, you can see the before and after of this procedure. The Glam Gums procedure is done when someone has had or has dark pigmentation on their gums, and it basically removes that top layer of pigment, and you end up with a result where your gums look nice, pink. And Barbara, you reported that your gums looked it felt smoother as well.
Oh yeah, they made a squeaky sound.
They made a squeaky sound.
I remember when I would do like that, they actually made the little squeaky noise. Yeah.
Nice. So can you tell? Let's watch this video. We did this procedure on you 2 years ago? About 2 years ago.
Yeah.
Yeah. Let's watch it and.
Oh, I never seen it.
Barbara, you've been with us for
3 years.
It's beautiful.
Hi guys, this is Dr. Rashad Riman from our dental group in Beverly Hills, California, and I'm sitting here with Miss Barbara Young.
Hey guys.
And what I want to show you in this
Let's go to a break, and we'll take care of these difficulties, and we'll be right back with you guys. All right? Don't go anywhere. Don't go away. I'm gonna make us have one of these.
Stay tuned.
Oh, there's a charger here?
Did it die?
Right here. Hey.
Out of all things. It's okay. Yeah, it's gonna be short. Yes, it's gonna be short. Sure? The cable expression.
what about that outlet? No? Oh, all of them taken?
5-second rule.
Yeah. 5-second rule. Everyone knows the 5-second rule.
I think you need it again, right?
Yeah. I didn't ever get the lure though.
It lasted a year?
Yeah, about a year. Over a year. Mm-hmm.
You've been with us for 3 years?
Since 2016?
Time flies.
Yeah. December, January, February, May 2016, 17. It'll be 4 years this year.
Wow.
Yeah. Because I came right after Julia was just born that year.
You came after Julia was born?
She was born in April. No, she was born right before she was born. I mean, right after, yeah, because she was born in April. I came in December. So she wasn't even 1 yet.
How do you know that?
Yeah, but since it was far, so I had to put the gain up and I'm putting up more room noise. And earlier you were talking louder. Now we kind of.
Okay.
So yeah, that's why I put it there. Better.
Oh yeah, thank you.
Good job, Gina. You did good, right? Gina did good.
Yeah.
Homegrown. I want you
Awesome.
to sit up straight. I want you to look as good as you did.
Yeah.
In your life.
You're next. To be brain.
His back needs to stay straight.
Hold my.
This neck? That's what. You know what I'm saying?
Like this. Like I'm holding it in. I'm not going to squeeze it out. Okay. Like a really.
Oh, you sent it to me, right?
Look how he's sitting with his face.
Poor Roddy. He's a troop.
Wine?
Yeah.
It's playing now, but it's not.
No, it's not playing. It's playing there.
Should I unplug it?
Yeah. You can hold the candle. Let's unplug this. I think it's dead, so it's trying to. Yeah.
So for Saturday, we'll come on Friday. We're going to build a set. That's working. Is that off?
Yeah. You want to eat?
I'm trying to eat it. Because it's hot. No, eat it. Have you tasted one?
I've never tried a milk. Have you tried a hot one? Probably like a.
Probably good.
Not it's tasty. It's normally a milk. Have you tasted it before?
No.
Taste it.
Yeah? Sure it's not gonna make you go to the restroom?
Mm-mm.
You guys didn't say that.
It's not very healthy that way.
Oh, yeah.
Me and my dog go 2 times a day.
Yeah?
Video or start?
Hello guys and welcome back. In this segment we're going to talk about the glam gum technique. Yours truly invented this technique to eradicate gum pigmentation so that your dark gums become nice, healthy looking and pink. And Barbara, I did the procedure on Barbara here a couple years ago. And let's take a look at this video and then we'll come back and we'll discuss this further.
Hi guys, this is Dr. Rashad Riman from Art Dental Group in Beverly Hills, California, and I'm sitting here with Miss Barbara Young.
Hey guys.
And what I want to show you in this video is we did the glam gums depigmentation procedure on Barbara, and I want to show you guys the actual results. So check this out. This is where we started out. Barbara had some pretty severe depigmentation. And then this is 3 days after the actual surgery. That's another smile shot. That's a before, and that's the after. So as you see, let's hear from Barbara how her experience was.
Hi guys, I had very minimum pain. I can say that I took my pain medication only when I felt a little burning sensation here and there, but overall, no pain. It was pretty cool.
And show them those pink, nice gums. Wow. That's glam gums, the best way to get pink.
That video was like how old? Like a year old maybe?
Yeah, 2 years. 2 years.
2 years.
Yeah.
2 years. So if you're out there and you have dark pigmentation on your gums, you don't have to live with that. You can remove it. There are several ways you can remove it. You can use lasers, you can use chemicals, or you can use glam gum. And glam gum, we use a pressurized water mixed with an abrasive to remove that. And what's great about glam gums, you're not burning your tissue, you're not putting any chemicals on there, and that's some of the complications that happens with that procedure. If you do it with lasers or a scalpel or other different techniques, you actually cook the tissue, or you remove more tissue than you need to, or you end up with recession at times. So Barbara, can you tell me a little bit about after you got that procedure done, how did people react when they saw you? Did people notice or no?
Yes, they noticed right away. As soon as I smiled, and I'm always smiling, so they noticed right away. They, I have a lot of reactions like, "What did you do?" And I'm like, what do you see? And then they'll say like, something is going on, something is different. And then I'll tell them, well, my gums. You know, they can tell something was, you know, different, but they couldn't tell exactly what it was until I told them. And then when I told them, especially with my African American friends, they all were like, oh, I want that, because a lot of us have dark gums.
Pigmentation.
Yeah.
Yeah. Well, it's a great procedure if you are not happy with the pigmentation. It does brighten up the smile, but it does come back, and it comes back at different levels with different people. So that dark pigmentation, it comes back. So if you want to keep it nice, bright, and pink, you probably need to apply it every 6 to 12 months regularly to keep your gums pink, healthy looking. Again, dark gums are not necessarily a sign of disease. In Barbara's case, she had healthy gums, but they were dark. So we were just doing that procedure solely as a cosmetic solution. And if you are considering that procedure to be done, know that it will come back. Know that there is some level of discomfort initially when you do it, because you kind of peel off that top dark layer of gum in there. Any questions? Any questions on this procedure?
Barbara, how long did you have pain for?
Really not much pain. It was more of a burning sensation.
Burning sensation.
Yeah, so I can give you an example. Like if you fall and scrape your knee or elbow or something, you know how the white part shows?
Okay.
And it's like a stinging sensation. That's what it felt like on my gums.
Were you able to drink water, cold stuff, hot stuff?
Anything.
It was normal,
It
right?
was normal. And
Okay.
I used a lubricant that they gave me, and I kind of massaged it over my gums.
Okay.
And I used a silk toothbrush to brush my teeth.
Okay.
Well, actually the gums, like right at the gum line.
Okay.
A regular toothbrush for my teeth, but I also use it, you know, the silk one, because if I accidentally touched my gums with
with
the
a regular
toothbrush,
toothbrush.
it hurt because they were still healing.
Okay.
But besides, I really didn't have much pain. I didn't.
And
take
that
much
healing
pain.
process, how long did the healing process take?
Like 3 or 4 days. Like
3 or
I
4
think
days.
the third day we did the video and they were already
Okay.
yeah, pink
Awesome.
and fine. Hmm.
That's
But
wonderful.
the total, I say about a week, and then I heard the squeakiness like on my.
That's
they were like
awesome.
much to me. They look much better than before.
Okay. Now, your gums being depigmented,
Mhm.
does that bother you, or like
Being dark, yes, because
Okay.
when you smile and you have these dark gums, it's like your lip, and then you know you have your
Okay.
dark gums. To me, like when I would look in the mirror, I didn't like that because
Yeah.
I already have like you're dark, and then you have dark gums. Everything is just black, and then you have these white teeth.
Okay.
So when I brightened my gums, it just gave I found myself smiling all the time because I knew I had pink gums.
So you were more confident.
Confident,
You were
yes.
more confident, and you were smiling more.
Yes.
So your energy was higher.
Higher.
So it was good.
Yeah, I loved it.
Awesome.
Cool. So there you go. Never do anything cosmetic just because your neighbor is doing it, or Kim Kardashian is doing it, or someone else is doing it. Only do cosmetic things if, when you do look in the mirror, between you and yourself, you feel that, you know what, I wish that tooth could be a little straighter. I wish that dark gum can be a little pinker. Beauty's in the eye of the beholder. We all have different we all have different tastes, so don't go under the knife unnecessarily. Only do it if you're gonna feel that it's gonna add to your level of confidence, if it's gonna add to the way you show up to the world each day. So hope you enjoyed this segment. If you have any questions, don't hesitate to reach out to us at our dental group and learn more about this glam gum procedure here. Thank you, Barbara. Thank you for sharing your journey with everyone out there, because they say there's a proverb in Arabic, and it says, ask someone who's done it, don't ask a doctor, because the doctor just treats it. But if you ask someone who has done something, they've been in the thick and thin of it. So would you recommend this procedure to, who would you recommend do this procedure?
Well, I can say I do recommend it when I talk to our patients who have dark gums. I show them mine, and a lot of them, want to do the procedure. So,
cool.
Yeah.
Awesome. Great. So we can close this segment with, I'm gonna Oh, that looks good. Let me just put. If you guys are watching us right now, we are doing the live recording of the Dental Buzz Show. So if you see things being chopped up and all like that, we are actually in the process of recording a show, and you are getting behind the scenes look at exactly how we're recording it. So let me here. Oh, I need to pull out the procedure.
So Barbara, I asked you earlier, what's your favorite procedure?
Yeah.
What's your least favorite procedure that you like doing or don't like doing?
Oh, cleanings. No,
Cleaning.
no, it would be I guess because it would be fillings.
Fillings?
And it's only because, I mean, it's something that it's like common, you know, a cavity.
Okay.
And when it becomes more like of a challenge, that's where, you know, I can challenge myself. Like, even if I don't know the procedure, I'm like bumping heads with Dr. Rashad, like trying to see what he's doing, and I'm like asking probably a million questions.
Okay.
It's because it becomes interesting, you know? Like, he might need me one day. I might need, you know, his arm may be broke or something. I might need to be his right arm, so.
Okay.
Yeah. I probably can do the procedure too. I just need a DDS behind my name.
I have another question for you.
Mm-hmm.
Who do you like working with the most?
Oh, let me see. I would say it would be Rashad.
Yeah?
Yeah.
Why?
Because it's more of a challenge. He's
more of a challenge.
It's more of a challenge. He challenges like the assistant. Like, you're in there doing holding and retracting in certain ways that you normally wouldn't do. So it's like it's giving me, you know, that extra, you know, like almost, you know, like under your belt. Like, well, how do you say it? Like I'm getting my feathers for my wings. Like he's adding feathers to me, because like eventually I'll be able to do other things, you know? So I believe like when in his procedures, he's detailed with things, and he's gonna, like he's a teacher at the same time when he's.
So I guess I'll tell Dr. Lydia and myself to challenge you more.
Oh yeah, challenge me. Well, you know, let me just be, so you guys won't challenge me too much. No, but really, he challenges me more. Lydia, I'm more, you know, it's like a sister when we're in there. Like, we're just, you know, I'm helping her with her procedures. We're just going about talking and stuff. Rashad is more learning. He's more on a learning curve. And with you, it's like more like that brotherly road too. You're like, thank you, Barbara. You know, Rashad is like, focus, do this, do that, retract. And, you know, and you guys are more like, oh, thank you. You know, more, and I just learn a lot from him, because and it's good though. It helps me. Like, I always tell our new assistant, Erica, who's awesome, I always tell her, if I can't do something, trust me, I will figure it out. And I get that from Rashad, because you gotta figure it out. It's just me and you here. So if I can't figure it out, I'll go to the next person to help and figure it out.
Okay.
But I get that from Rashad.
Awesome.
I appreciate your attitude, Barbara, because you don't take things personally. You're growth oriented, and you're always seeking to get better. So namaste for that.
Oh.
Yeah.
Whatever that means.
Salam alaikum.
Salam alaikum. Walaikum salam.
Namaste is an Indian word for, it means it's along the lines of, I realize the God in you. Or I realize the divine in you.
Can I say, I know, I kind of told this to them. I kind of know probably you guys better than you know yourselves, the doctors. Oh yeah, I know your strengths and I know your weakness, just from working with you guys.
My weakness?
I know.
What weakness?
What's our kryptonite?
I know. I know just based on just working with you guys. I know a lot about you guys. You believe it or not. And then like for you, like I heard him call you the extraction guru. And I remember when you took out my wisdom tooth.
Yeah, I took out your wisdom too.
And I was sitting there like, I was crying. I hate needles.
Yeah,
like,
she was
hate
crying.
needles. I was like in tears. I came in and I'm like, Rody, I need this tooth out. It hurts really bad. And you're like, well, it's right on the nerve. I'm like, I don't want to go and pay, what, $700 to go see an oral surgeon? And because it's on the nerve, I'm like, I trust you. He's like, okay, I can do this. I'm going to take it out. And then he went in there and he numbed me. And sorry, doc, he numbs very good. He like you, but probably, you know, he's really good.
Actually, you know who taught me how to numb?
Rashad.
Yeah.
Yeah, he told me he stuck it in your ear.
He stuck a needle through my ear. And no,
Yes.
I'm not kidding you. He stuck the dental needle through my ear, and he basically said that I wasn't going to feel it, and I really didn't feel it. And then he told me to raise my mirror, and all of a sudden I saw like this needle right through my ear. So he's the one who taught me how to take
the numbing,
or how to give dental injections.
I told you he was a great teacher because I remember he numbed me. And
yeah. So yeah.
Yeah. And he popped that thing out, and I swear I told him, I said, Rody, I love you.
Yeah.
I said, oh my God, like, and after that, like when I see him doing these extractions, I'm like, yeah, he got this, because I know how you perform the procedure on me. Like, it's a no-brainer.
Yeah.
Like, yeah, that's your forte.
It is. It's my calling.
It's your calling. And Rashad's is doing surgeries and stuff. Like, that's it's calling. Like, he enjoys it, because when he's doing it, he's teaching us as well, and he's doing the procedure. Like, a lot of dentists can't do that.
I think you enjoy doing surgeries more than cosmetics.
Yeah, like the surgeries are...
Depends
or it depends on the day.
Depends on the patient, actually.
Yeah.
You know, I enjoy working with, you know, every doctor has a patient, every patient has a doctor, and it's good to match your personality with your doctors and vice versa. There's a certain type of people that I enjoy working on. You know, a lot of it is energetic, I think. So that's why I tell my patients and everyone I deal with, I'm like, look, if you don't feel on a gut level comfortable to be with me, to be here, then I respect that. That means there's something in the divine telling us this shouldn't happen. And if you feel otherwise, that's also, I respect that. So I like people to get in touch with their inner feeling so yeah, so it's a match. I always look for an energetic match when I work with people, and my goal is I want to be able to serve that person at the highest levels. So if I can't do that, then I'm not the right person for them. And yeah, my brother is awesome with it. He's LA's wisdom tooth guru.
I love the name.
Like that name?
Yeah, I like that name.
Yeah, because he's good at it. He's so
right?
good at it.
Yeah.
And you traveled. Where did you travel? You've taken some
New Mexico.
courses in the process of becoming the LA's wisdom teeth guru. What courses have you taken?
So I've taken a couple courses. I went to Guatemala. I did a mission trip. And it was basically a week-long mission trip where all I was doing was taking out teeth. It wasn't only wisdom teeth, but it was mostly wisdom teeth. And the people there were so appreciative that we were doing this service for them. And so I took that course. I did a course in San Francisco. It was a weekend course. That was an amazing experience also. And then just my knowledge from before in dental school. When I was in the Army, I took out a lot of teeth, and then I used to practice in New Mexico, and I took out a lot of teeth in New Mexico, sometimes 60 to 80 teeth per day I was taking out. And it's because there's a lot of drug users there, so there's a lot of meth mouth, a lot of rotting teeth, and I just have this passion for taking out teeth.
That's awesome. And it feels good to find your passion, no?
Yeah.
So you take out the teeth, and Rashad will replace them.
I put them in.
Exactly. So it's perfect.
Perfect.
We work together.
Gotcha.
I was thinking the other day, I'm like, man, we exist in this life. We all have talents and skills, and we complement each other, you know? Our world is running. There's cars right now out driving. There's planes flying. There's people in hospitals. There's people in dental offices. There's factories happening. There's people eating. It's just an incredible organism, this life on Earth is, and each one of us has a role. And once we find that role, it's like we create an Academy Award-winning movie of our life. But if we don't have that role, then we struggle. And you know, it took me some time before I, you know, found the right mindset, the right healthy mindset to approach life, because not every day is gonna be nice and rosy. It's how we react to that that determines what's gonna happen the day after.
You know what I've learned? One is do what you're passionate about, what you enjoy doing, because if you do that, then it's not really a job. You're actually doing something that you love. And also, you should find mentors, or you should find mentors to help you because we don't know the answers to everything. And if you know someone that you trust, that you believe in, that is willing to become your mentor, then I would definitely seek someone out, because you'll have just a much easier life.
Amen to that, brother. I mean, mentors, it's all about mentors, because I'll tell you this Tony Robbins story, and you attended a Tony Robbins event recently, right?
This last weekend, I was at Tony Robbins, and it was a 4-day event, and it was an amazing experience. It was a lot of motivational, but there was also other things besides motivational. I walked on fire, and
Did you really walk on fire?
yeah, on charcoals.
Oh yeah.
That
Okay,
are
wait, charcoals that are dead, that
No,
were
no,
fire, or they're
no, no.
burning?
So were they hot?
They're burning, and there was barefoot. There were 15,000 people walking on charcoals, and the fire would die, and they would go get new charcoals every maybe 2 to 3 people, and they would lay them out.
So what was the
So
purpose?
was it from the freezer or what?
From the freezer.
No, like you're walking on fire?
Walking on fire.
Now, what's the importance of that? What's the psychology behind
The
that?
psychology is that we got so pumped before going outside that our brain level of energy was to a whole nother level, that walking on fire didn't really affect us. We were just, we like, it could have been as if we were walking on water, and we wouldn't
So
be
your
able to
feet
tell.
wasn't burning?
No.
Because of your energy?
They did not burn. You know when I felt it a little hot when I was driving home?
You felt your feet?
I felt my feet. I felt my feet were like hot, like really, really hot. But then I got home. I took off my shoes, and I looked at my feet. They weren't burnt. And the next day they were fine.
How fast did you walk across?
There was about 6. I took about 6 steps. It wasn't that far, but I was walking on 1,000+ degree temperatures.
Are you serious?
Yeah. Barefoot.
Wow.
I took about 6 steps. No, you can't run. You're not supposed to run. You're supposed to walk straight at a normal pace. Look up, don't look down, and I just psyched myself.
Sounds like a mind thing. Like if you look down, then your mind knows it's something hot. But
Yeah.
because of your energy level, it was like something that was radiating.
It was an amazing experience.
It's like what?
And
You wanna do it, Doc?
I think there were like 15,000 people that did it. I think only 10 people
Burned.
got their feet burnt.
Only
with
10.
blisters.
Why? Because they looked down.
I think they stopped.
No, they're not so focused.
I think they stopped right as I just kept walking. Like I looked up and I just kept walking.
And this Tony Robbins is amazing.
And the thing is, the hardest part is taking the first step.
Mm.
Yeah.
Once you take the first step, you want to get to the other
Yeah,
side.
because it's hot. It's like
so yeah, so it was a great experience.
Well, thanks for sharing that with us. So Tony said, if you find a mentor, it's like this. You play video games with a little kid, right? If you play video games with a kid, you'll go in there, he'll just cream you right away, right? He'll kill you.
Yeah.
You can't survive. Why? Because every time he's done it probably hundreds of times before. So he knows exactly where the bad guy is going to pop out. And he shoots him right when he's going to pop out.
Right.
Whereas you just jump in there and you're like, all right, I'm older than this. I can beat him. That's what a mentor does. The mentor tells you where the bad guy is going to pop out, so you don't have to get shot by that bad guy. So you shoot the bad guy before the bad guy shoots you. And that's the analogy that actually Tony Robbins, in one of his, I think, Unleash the Power or something, his programs, he mentioned the importance of a mentor. The challenge for me has been finding that mentor, you know?
But the thing is, like, for me, I wish I knew that I should find a mentor or seek a mentor like 10, 15 years earlier.
Yeah.
The idea of finding a mentor was all recent, like in the last 2 to 3 years.
Right.
And I just wish that I had the knowledge or someone told me about that 10, 15, 20 years ago, you know?
Yeah.
But
It's all good, man. It's in the journey, right?
it is in the journey.
Yeah.
Yeah.
Great. So next, we are going to talk about if you are scared of dentistry, you can do it while you're asleep. So what is this sleep dentistry? Is it real? Is it for real? Is sleep dentistry for real? People ask us. So let's go and in this segment talk about actually cut let's talk about a different thing in this segment, since I have it already set up. So, Michael, let's go back to the beginning and start the segment. And if you're just watching this right now, we are actually recording the Dental Buzz Show, and you have behind-the-scene access to what we're doing. So we're bearing it all for you guys, and our mistakes and mishaps and AWOL stuff. So that's what's happening. So if someone's asking, like, hey, what's happening here? What is this? Let them know this is the actual recording of the Dental Buzz Show. All of this is going to be edited and fixed later on and prepped for release. However, right now, this is live. It's like you're in a movie shoot. You know, there's several takes before the director says, that's the one. Okay, so let's start now. Hello and welcome to this segment where we're going to talk about something quite interesting. Have you ever been on the highway, looked up and seen someone with a missing tooth, and right next to them it said implant dentistry, $395 or $300 for an implant?
Yeah.
So in this segment we're going to talk about what's the difference between a $395 implant and a $3,995 implant. I mean, it's America, right? So everyone has a license who are practicing. They're all doctors, you know. So isn't it the same freaking thing? And aren't both people doing the implant doctors? That's such a great question. Any thoughts on when you've seen that on the highway? What thoughts have been in your head?
The first thing I see, $395, is for the implant itself. I guess because I know. So it's like $395. They're leaving out the implant has to be something cheap.
So there's other components that are
involved.
Yeah.
There's
an
implant, the abutment, there's the crown. They're leaving out the other information.
Okay.
Yeah. So usually when I see that, there's other stuff, and then $395 for an implant itself is me just knowing dentistry is pretty cheap.
Yeah.
Yeah.
The first thought that comes to my head is it's a gimmick, or they're trying to bring in the patient with such a low price, and then once the patient comes in, they're going to upsell them on other services to complete that implant. The second thought that comes to my head is you pay for what you get. I wouldn't want to go to a doctor that's, if they're truly only charging $395 for just the implant placement, I wouldn't want to go to them because I know what's involved in just in material costs. I know what's involved, and using proper materials, I know what's involved, and it's way more than $395, and that's not even including doctor's time. So you pay for what you get, and there's a pool of patients for that type of clientele.
Yeah.
But me personally, I would never want a $395 implant.
Yeah. You know, it's the $395 implant. It is a doctor who, you know, doctors are placing them. It's kind of like, it comes back to your philosophy on life, how you want to be treated. If you're willing to take the risk to go to a place that is a volume, and maybe you're at a stage in life where that's all you can afford, then it might be a good option for you. But understand that if there's a volume, then things fall through the cracks somehow, somewhere. And the only way people can be making money off these prices is if there is volume. And they are making pretty good money because a lot of people see implants as a commodity. In this next story that I'm going to show you, I'm going to show you a story where a patient went to a similar type of situation, thinking that they are saving money. But check out what happened here. So we're going to cut to this video. Okay.
I remember the first time I saw Alba. She opened her mouth slowly, hesitant, a little scared. And when I pulled back her lip, and saw her implant and how it was inflamed and how the tissue was around it, I was a little shocked, frankly. After getting to talk to her and getting to know her a little more, I learned that she had that implant placed and some time ago, and she kept going back to that dentist and they were not able to fix and salvage the situation. So I was sitting there and with a case that was gone south, and I needed to find a solution for Alba.
Cuando vi al Dr. Riman, yo pensé que era como los demás dentistas, su trabajo y todo, pero no, es una persona agradable que me dio confianza. Vi que me ha dedicado mucho tiempo, es muy amable, aparte de ser muy profesional. Bueno, lo vi como un ángel que vino a mí y me ayudó con mis dientes.
This is the, so as you can see in Alba's case here, Alba went to a situation, a clinic where it was a volume clinic. And there's no doubt the dentist knows what he's doing. You know, he's placing a lot, but there's so much detail in doing proper implant work. And even when you do it all properly, things don't always go as you plan. But what happens is Alba, they couldn't fix it for her. She had inflammation around her implant. She had a risk of losing her implant. It was not placed in the proper tissue. And it was placed at an angle where things were not working out too well for her. So, beautiful person, Alba. She's awesome. And she kind of, when I saw her, she had lost trust. She's like, where do I go? I mean, I paid this money. Now I need to pay more money. And the person who did it, they can't really help me. So, it's not a good situation to be caught up in. And so, let's see what happened next. All right, next, what I needed to do for Alba was I needed to create a plan to get her out of the issue there.
I love doing surgery and I love challenges, and all I needed was to get the trust of that patient. And Alba has been through a lot before she came to me, but we somehow connected on a certain level, me and her. I saw how beautiful and how hardworking and what a beautiful human she was. So I took a look at Alba's case. I realized that Alba, the quality of the tissue around her implant was lacking. And that had to do a lot with why Alba was facing that challenge and complication with her implant. It didn't look good, it was red, it was inflamed, it was actually scary looking. And the crowns that were on that implant were not very aesthetic at all. I had to solve two things. I had to make sure first to treat the gums, and then once the gums settle and are treated, I needed to do a proper aesthetic crown for her.
Here's the thing, our bodies are so forgiving. So even if you go to places where they are charging like $3.95, a lot of times things work out. But if it's that one time where things don't work out, then you can be setting yourself up for, you know, a lot more surgery and a lot more heartache and pain and a lot more expense as well. So bodies are forgiving, things usually work out, but when they don't work out, it's a problem. And in Alba's case, it was a tissue issue. The issue was in the tissue. And unfortunately, it hasn't become mainstream yet to where we as dentists are dealing with the tissue. More and more each day, we're growing that body of knowledge through Surgical Master, what I do with me and my partner. But the tissue around an implant is just as important as the bone. So if you don't deal with the tissue, you're gonna get issues. So check out how we actually take Alba and we actually solve her issue in this last video of this series right here.
We did 2 surgeries to rehabilitate the gums, and then after that, we waited some time till the gums stabilized, and we went ahead and we restored Alba. It was an amazing case to work on. Whenever I see patients who are hardworking individuals going through life and going through these challenges and still maintaining a smile on their face and warmth from their heart, I give them my all with all my being because they deserve the best in treatment. That's why Alba's case, it was gratifying on a very deep level for me. as a dentist, I feel a responsibility to other dentists as well to educate and inform them of the proper protocols. And I do that through my company, Surgical Master, alongside my partner, Dr. Zeev Simon, where we put on courses and educate people all over the world on the importance of site development, soft tissue development, hard tissue development when you're doing implants.
You're amazing.
Thank you. So that's the thing. Doing a soft tissue procedure is like you're asking the patient to pay another X amount of dollars, or $1,000 or more dollars. And when you're practicing in areas where it's really just money focused, like it's the cheapest you can, the energy, the aura is, we just want to get as many people in, let's do the surgery and get them out. But what happens in these things is that things get missed. What's usually not an issue becomes an issue. So that's what you guys need to look out for. That's the difference between $395 and $39.95. And there's a good somewhere in the middle there in between where the dentist is actually getting their fair compensation for the amount of years they put to go to school, all the struggles that they went through to become a dentist, the paying their employees salaries, there's a fair level of compensation that goes there. So whatever you're playing in life, always play win-win, because if things look too good to be true, sometimes they are too good to be true. So keep that in mind. And win-win is the way to go. We try as much as possible to, do our due diligence ahead of time and inform our patients if there is going to be an issue, what that issue is going to be, and what other expenses, what other procedures are needed. Dentistry is not a commodity. Dentistry is a service. There's a difference. A commodity is something that it's the same whether you buy it from this guy or that guy. And even a commodity like flour, there's different grades of flour. There's flour that has animals in it, little things these black things that walk around. There's clean flour. The corn, there's good corn and there's corn. So even commodities have different levels. So imagine a service. You're getting a service where one human being is touching you to fix something that you need on your body. And the effect is either healing or more disease. You want to be taken towards more healing. So that's something I feel passionate about, because usually people don't know it until they've been through it and they've been burnt. So if you're watching this, do your due diligence, go to places and do your research, and don't take shortcuts in your health. It will bite you later on. And sometimes we do it without knowing that we did it. So if that's the case, then that's all right. But do your research and get multiple opinions always.
Awesome.
Anything to add on that? Have you ever done something and because you didn't get a second opinion or you felt pressure to do it right away, you've been like, man, I regret doing this, and going back is like, already paid money, things already happened. Have any of you experienced that before?
You can say I
Can you
have.
remember an incident? If you can, it's okay.
For me, no.
No?
I feel like most people are impulsive buyers, but like I'm not. Like if I want something, I'll sleep on it and I'll think about it the next day. Do I really want that thing? Like, do I still have that same drive or energy or desire for that? And if so, then I go ahead and get it.
Cool.
But like these people that like try to, if you're at the mall and they're trying to sell you something, they're like, oh, it's only today that you can get this price for this. I'm like, okay, great, but if I really, really want it, I'll pay for full price for it. So I don't like people throwing offers that are too good to be true. So I'm always weary about that.
You know why they do that today? Because a lot of people don't take action, and they need to feel some sort of pressure to take action. However, when it comes to your health, now I don't mind that if it's like a deal on maybe something like tangible that
that clothes and shoes,
clothes or you know. But if it's my body and I feel that someone is pressuring me to do it the same day, or there's some kind of deal, I get a little weary of that. Awesome. So next, let's cover sedation. All right, let's go to the wide again. And again, if you guys are just watching us right now, we're in the process of recording the Dental Buzz Show. And you are actually getting behind the scenes access to the actual filming of the show. So that's why you see us stopping and starting and messing up and saying things that might not be too PC at times. So that's the case here. All right. Welcome to this segment, and in this segment we're going to talk about sleep dentistry. Is it real? Can you be asleep and get your dentistry done? Do you believe that?
Yeah, I do.
Yes. Why? Because you probably have done some cases.
Yes, I have.
Nice. And of course you've seen it in the course of your with awesome. So I want to look. I love to go to sleep and get my dentistry done. My brother, on the other hand, does not want to go to sleep, and he'll get his dentistry done awake. It all comes down to your own personal preference. To me, the sounds of drills, everything is just too overwhelming. And if I can afford to, go to sleep, have it all done, wake up, and then go on with my life, that's what I would choose. So if you're watching this and you need a lot of dental care done, think about sleep dentistry. And in this video, we're going to go right now to one of the anesthesiologists that I use in my dental cases. So whenever I have, for my cases that need dental sedation, I use a anesthesiologist that just commits to watching over the patient, making sure they're safe, they're comfortable, and they're well asleep throughout the procedure, and then he wakes them up at the end. That's Dr. Einstein. So let's go to the video here.
Hi, I'm Dr. Rashad Riman, and I'm here with Dr. Thomas Einstein. And Dr. Einstein is an anesthesiologist. And what's great about having an anesthesiologist in a dental setting is that,
well, we can make things happen that otherwise might not happen because patients can't do it without anesthesia.
Yeah. For example, we just had a case this morning, and it went very smooth, versus if the patient wasn't anesthetized, it would have been very hard to do the level of work that we were doing.
Yes.
How often do you do dental anesthesiology?
Oh, pretty much every day. It's kind of interesting to me because when I first started this, I didn't realize how many patients needed this kind of treatment.
And is it safe if patients are weary about it being safe or not? Is it safe to be put under?
Well, yes. I mean, but the important thing is that you need to have somebody that understands the patient, what their problems are, works together with their doctors. But for the most part, most patients can tolerate anesthesia very, very well, and it's just a matter of doing it correctly.
Yeah, and what's great about Dr. Einstein is that he's an MD. You're an MD, right? Who's focused on. So it feels. I like having that peace of mind that my patients are being taken care of by a medical doctor who has been through extensive training and you specialize in dentistry, or how is it?
Well, interestingly, I started out doing all types of anesthesia, and mostly hospital outpatient surgery. And I started doing just a little bit of dentistry, and it's evolved to be basically my entire practice.
That's awesome. Well, us dentists, we're lucky to have someone like you that we have access to.
Well, for me, it's been a discovery, and I have to say, after all these years, I enjoy working with dentists more than MD surgeons.
Awesome. Well, if you're out there and you are worried about getting any dentistry done, that you shouldn't be worried, because it's possible now to have you be put to sleep safely and in a controlled environment with professionals like Dr. Einstein here and myself working on you to really fix whatever needs you might have, because neglect will really get you to points in life where you'd regret and having you lose your teeth, your ability to chew. So yes, dentistry is not a massage, but at the same time we are all lucky and we're in a point in history where it can be done without having that terror that's identified with dentistry, without you experiencing that anymore. You can be asleep.
Yeah, can I say a couple of things?
You can say as many things.
First of all, I want to thank Dr. Riman for letting me be part of his team, and he did a tremendous job from what I saw today. And second of all, different people have different needs. Some people need anesthesia for dentistry just out of fear. Some because they have medical conditions, some because they have gagging problems. Some people have children who can't tolerate dentistry without anesthesia. And our job is to make it safe, untraumatic, easy, and we're here to serve you, basically.
That's awesome. It's an honor to work with you.
Thank you so much.
This is top level dentistry.
Oh, thank you.
Thank you.
Pleasure.
Thank you, guys. Thanks for watching.
Awesome.
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 There you go. Dentistry while you sleep. It's a reality. Barbara, can you tell me a little bit about, you assist me in a lot of these cases.
Mm-hmm.
Can you just talk a little bit about what patients should expect, all that stuff going into a dental sedation case as far as you assisting me?
I can say that I will ensure that they're, even when Dr. Einstein, even when he's doing his thing, I'm making sure he's doing his thing. What you doing over there? Even his eyes, why is that going up? Beeping noise, what's going on? It's like, because I know the patients, they are comfortable with us. They know us, so they are trusting us. They don't know this guy. So it's like, if they have that trust in us, I want to make sure that I'm taking, proper care of them even while they're asleep. Like, we're responsible for every inhale, every exhale. And so if they're not inhaling and exhaling, I'm like, Dr. Einstein, why is that beeping? Why is this not, And he's like right away, oh, they're fine. I got it. He's on his thing. I'm on mine. Dr. Rashad's on his. And everyone is making sure that the patient is safe. Like, we're I'm not even allowed to look away. Like, while I'm in there, there's no looking away. Like, I want to make sure that the patient, is comfortable.
Yeah, it's a lot of trust involved when you're doing sedation cases,
Yeah.
because the patient comes in and, luckily Dr. Einstein is a great doctor. He keeps the sedation steady.
Mm-hmm.
Steady is key when you're doing sedation, because if the patient is moving a lot, you keep stopping and starting, then it delays things.
Mm-hmm.
So that's something that's great about working in this area in Beverly Hills, that you have access to top level people in their professions from all over the world, and it's good to work with people who are at the top of their game, because then that helps me give my patients what they came to me for, which is the best possible results. So If you're watching this and sedation, you're scared of dentistry, and you've been neglecting to see the dentist for the past 20, 30 years, and you're a businessman, or you're someone in the entertainment industry, or you're just...
Or you're a dentist.
Or you're a dentist. Like me, who doesn't like to be awake when you're having dentistry done, then sedation dentistry is perfect for you. And if you don't like to be fully asleep, then there is pills. Can you tell us a little bit about pills, Dr. Rodi?
So there's pills, there's also nitrous, there's a combination of pills and nitrous, so there's different modalities to help manage the patient. But you specifically asked about pills. There's a few different types of pills that you can take. They basically, you're awake, but you are very, very relaxed. So you can go through the dental procedures easier. The only thing, you need someone to drive you to your appointment and to take you back from your appointment. It just basically puts you in a happy state. But you're fully awake, you're not sleeping, and for a lot of people, that's all they need. They just need to be a little more relaxed, and you know, those pills definitely help out.
Awesome. Neglect is costly.
Correct.
Prevention.
Yeah, neglect is costly, not dentistry.
Not dentistry. You said that, huh?
Yeah. So, you know, because when you neglect your teeth, then you need more work.
Right.
So it's better to catch it on
So
early.
prevention is cheaper, and
also
neglect is more
prevention
expensive.
It's better.
Exactly.
than
Yeah,
harm.
that's another way.
Yeah.
So
awesome. Thank you, guys. Thank you for joining us on this segment, and we look forward to seeing you in future segments. If you have any questions, just reach out to us, let us know your questions, and we will address them in future episodes of the Dental Buzz Show. Thank you so much. This is Dr. Rashad Riman.
I'm Barbara.
I'm Gina.
And Dr. Rodi.
Awesome.
Till our next show. We'll be
Yeah.